Hi, I want to be going over with you today some early signs of neurodegeneration, and I want to separate some different terms here. There's something called transneuronal degeneration, which means that the neurons are not fully dead, and then there's permanent neurodegeneration. Now, how do we know the difference from one to the other? Well, the transneuronal degeneration, the testing of the patient will get better. The permanent neurodegeneration, the testing of the patient will not get better. So there's no other measurements to decide that. You can't do any other deep testing to say, hey, does this cell have the ability to respond? So you have to measure, find the deficit, set up the treatment, treat, and then retest again to look to see if it actually, in a sense, wakes up and is functioning better. So what I want to go over with you is there was an interesting review article that came out in the online version from the Journal of the American Medical Association Neurology, published February 19th, 2018. And the title is, When Do Alpha-Synucleinopathies Start? An Epidemiological Timeline. What you want to know by that is they're saying, when do we start seeing these signs of neurodegeneration? And what we know is these are the pathological hallmarks of Parkinson's disease with dementia, dementia with Lewy bodies, and multiple systems atrophy. They begin years before a clinical diagnosis, years and years and years. So I call them soft signs. Do we start seeing some soft signs that the brain is not working well? And the answer is we do many times, but we have no idea that this is our brain breaking down, and we either joke about it or we think it's not a big deal because it's happening to so many people around us. So when I look at from this article again specifically, they found a few things that show up very, very early. Olfactory dysfunction. This means the inability to smell, because this is described in the premotor phase of all alpha-synucleinopathies. So the lag time between the appearance of this symptom and the onset of motor manifestations, like maybe I'm getting a tremor, shows that it can happen very far early before you start getting these symptoms. So any issue with your smell increases the risk of Parkinson's disease and other neurodegenerative diseases. So you should be aware of that. And I have plenty of patients that come into me with these neurodegenerative diseases, and they say, yes, I've had this problem for a long time frame. I just thought it was normal. It's not normal. Number 2, constipation and dysautonomia. So constipation is obvious, right? Oh, constipation means it's my gastrointestinal system. No, silly. It actually means your brain is breaking down, and constipation is one of the signs of dysautonomia, which means the autonomics are breaking down. And if we run tests like I run in here, we can measure the autonomic nervous system and tell you whether there's problems with it or not. So dysautonomia can show up as constipation. It may also be excessive bowel movements. It could be blood pressure issues. It could be standing up and getting dizzy. It could be erectile dysfunction. It could be a pounding heart. It can be all types of issues creating these imbalances that are being caused from the dysautonomia. The next one to me is a little bit startling, but it's very well researched, that anxiety and depression are common complaints associated with neurodegeneration. Can you believe this? So anxiety and depression are relatively common in these patients, and what they're finding is that maybe anxiety and depression is not a psychological cause. Maybe it's actually happening from your brain going through a transneural degenerative process, which means it can get back to normal, or maybe there's some permanent neurodegeneration taking place there, and it has nothing to do with psychological causes. Can you imagine that? How many people are being misguided in telling and talking about their anxiety and their depression symptoms as if there's a psychological factor driving this, and it may be a sign of early neurodegeneration. How about if you come in with anxiety, depression, and you're constipated, and your heart pounds, and you don't sleep at night, and your smell's off? Wow, those are all significant signs of neurodegeneration. So the next one, sleep. Sleep's a big one. And you know how many people are having trouble with sleep? Tons and tons. If it gets bad enough, I just don't sleep. I don't know. Oh, you don't sleep. We all laugh about it. And then there's the really significant people that go into insomnia, which means they're just really not sleeping. Then they start popping Ambien. Maybe they can knock themselves out and they might sleep, but the underlying mechanism is that the brain is breaking down again. It's an early sign of neurodegeneration. So you should be able to sleep on a regular basis and get a good night's sleep, not be waking up all day long or all night long, and also not having trouble falling asleep. It should happen normally, like a bowel movement. You should just sleep. And the next one we see is anemia. Anemia basically is a sign that you're not having good oxygen inside the body, and it might be a cause of neurodegeneration, or it might be an effect again of the brain breaking down, and then we see anemia. Either way, we know that the brain and the gut communicate, and the gut is where we would absorb nutrients to not become anemic. So it could be the brain breaking down, creating issues with the gut, and you're not going to absorb the nutrients, and then you would become anemic. Or is it possible that you're getting lack of nutrients coming in, and that's one of the triggering factors of the brain neurodegeneration? And the answer is it's likely happening in both directions, most commonly. So I hope that this makes sense to you. I hope you also will recognize that we need to look deeper into these things and not just assume that these what seem to be no big deal, they are. Another big one I'm going to talk about also here is signs of dementia and early signs that the brain is breaking down. And I'm going to go over a couple of things here with you. So some early warning signs of dementia, Alzheimer's, is memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks at home, work, or leisure, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing. People come in and say, I just can't get my words out. Misplacing things and losing the ability to retrace steps. Why am I in this room? What am I doing here? Decreased or poor judgment, withdrawal from work or social activities, and changes in mood or personality again. The early signs of Parkinson's, again, can be loss of smell, gastrointestinal constipation, bradykinesia, which means you're moving slower, depression or anxiety, postural instability, balance issues, fatigue, and sleep disorders. So all of those things can be happening over a time frame and be early signs of the brain breaking down. And what you want to know is that there's many different causes of why we would see these transneuronal degenerative process or even straight neurodegeneration. And they're not connected to genetics. I have a book in here somewhere that talks about, I got it right here, that talks specifically about neurodynamics of neurological disease. It talks about the three big neurodegenerative diseases. This is Parkinson's, dementia, and Lou Gehrig's disease. And what they say in here is this: as far as dementia and Alzheimer's, 1% of it is genetic. As far as Parkinson's and Lou Gehrig's, 5 to 10% is genetic. So there's not a major genetic cause in this stuff. So you're not doomed by your parents, but you could be doomed if your parents are showing this and you do the same exact thing that they did wrong. That's why you would come to someone like me to identify what are the root functional causes and what can you do to restore function. And lastly, I want to go over costs. If you're showing signs of transneural degeneration, or even you've already been diagnosed with Parkinson's, ALS, Alzheimer's, dementia, just to give you an idea, out-of-pocket costs for Parkinson's patients on a long-term basis will be $39,000, direct cost to that patient. That's not what the insurance is paying. That's the out-of-pocket cost to the patient. That's $39,000 a year. The ALS patient will pay $33,000, direct out-of-pocket cost to the ALS patient. And the Alzheimer's dementia patient will pay $56,000, direct out-of-pocket cost to those patients. That does not mean insurance again. That's what the patient is going to have to pay. So in my mind, you're going to have to pay for care if you have one of these issues going on. In my mind, it makes sense to invest in a program like ours that has the ability to uncover the root functional causes and get a precise functional diagnosis and not just a medical diagnosis, and work on how can you improve the way things work. You're going to pay for care. whether it's paying for someone when you can no longer take care of yourself, or it's paying for us. Our care on average ranges from anywhere from $5,000 to about $28,000 plus or minus. So it's much less than these, anywhere from 40 to 60% less than these costs, and we get usually a much better result for almost all patients that qualify in 90% of the cases. So thank you, have a good day, and if you have any questions, please let us know.